Hi everyone, welcome back to my channel. I'm sending to all of you guys a big hug and saying thank you all, and you are welcome back today. Yes, today we will be talking and discussing about some of the deadly diseases which we can contact today. Yes, around our neighborhood today, it is everywhere. A lot of people are having a lot of different diseases, but these diseases can be contaminated through pollinated water, just through our feet. And me and you can have this disease, and we might be thinking that we have been poisoned. Yes, because of we have immersed our feet or get in contact with contaminated, pollinated sewage waters. A lot of people spill sewages in the body of waters. We can get some of them during the raining period, especially now we are, and a lot of people put in contaminated containers of compounds, especially heavy metals that are not compatible to humans, because of our feet can be able to absorb things and which have a certain reaction in our body because they are attached to the organs in our body. I mean, major parts of the organs in our body, that is liver, kidneys, and rest of your lungs, which can as well poison ourselves inside without we knowing. So today we'll be discussing about these bacteria and how we can contact it, and step by step on how we can keep ourselves healthy. The first of these diseases we are going to discuss today is leptospirosis. Leptospirosis is a bacterial infection that is caused by contact with water that is contaminated with animal urine. Yes, waters that are directly contaminated with animal urine, either through water, through soil, or even contaminated with animal urine, that is food that is contaminated with them, something like fruits or stuff like that. Yes, these ones are very, very, very deadly. It's also normally or commonly found around the world where we have a warm climate, especially here in Africa. We have a warm climate. You also know that we have it, so we should watch out for leptospirosis. This is a very deadly one. What are the symptoms in which, if you are feeling, you need to go for a test or examine yourself? You can have a fever symptoms. Sometimes when we have fever symptoms, we just say it's a malaria or typhoid. No, it can be leptospirosis. Headache, we can have it. Sometimes we say it's a malaria. No. Muscle pain, and even severe cases of sometimes organ failure. This can go far. I said yes, it can be absorbed through your food and get into your body and attack all your organs, or some specific organs like liver, kidney, and thereabout. Another one is hepatitis A. Yes, it's a viral infection that can be contacted through contaminated water. Yes, a lot of people think hepatitis can be just through touching and all that. Yes, hepatitis A can be contacted through infected water, and this is very, very deadly. It is not just that we can contact it through food or any food that is contaminated with infected waters. What can this affect in our systems? It can affect our liver. It can cause symptoms to us like fever, fatigue, nausea, and jaundice. So when we are seeing such things, do good to yourself to do what? To visit your healthcare to know actually what is wrong with you. It must not be a malaria. That is a symptoms a lot of people think it is. Another one we can contact through our food or contaminated water is cholera. Yes, we know what cholera is still doing this year. Cholera have taken thousands of lives of young ones and can kill someone immediately by dehydration. This bacterial infection is caused by indigestion or digestion of contaminated waters with vibrochloria. And what is the symptom of this? These symptoms of this is severe diarrhea and dehydration, which can be fatal if not untreated, which we have seen a whole lot of people that have died of cholera this year. Thirdly is giardiasis. Giardiasis is a very, very bad disease as well in its own. This is a parasitic infection. It is caused by giardia parasites. Yes, this can affect our intestinal and cause a very big problem. These giardiasis or the giardias parasites spread through contaminated food or water by person-to-person contact. It is common in areas with poor sanitation and unsafe water. Yes, the contaminated food or water, we can get giardiasis or giardias parasites. So we have to watch out for it. Make sure that what we eat and what we do, it is safe. It can cause diarrhea, abnormal pain, and dehydration. One might think, I have cholera. You don't know that what you are facing is giardiasis. These two things are so different. That's why if you are having any of them, do well to do what? To visit your healthcare professional. Another one we are going to, which we see a lot of people are having problem with, is hookworm. Hookworm is seen as a very, very simple thing, but it's never a simple thing. This parasitic worm can enter the body through the skin, often through barefoot, especially this rainy season. Our children, our young ones at home, we have to watch out for them, and they are in holiday as well. We should watch out for them, especially each time they are in holiday, not to walk barefoot, because this hookworm can get inside their body through just their barefoot. Those infected by this worm may experience abdominal pain, diarrhea, or even weight loss, and also tiredness. The symptoms is this: it can also cause itching or rashes and even anemia as well. These are the things it can cause, or we can feel in the body. You can see it in your skin and all that. It will enter into your system and your skin and walk inside your body. It is very, very dangerous, hookworm. We have to watch out for it. Another one is schistosomiasis. Schistosomiasis is a parasitic infection which is caused by contact with a fresh water contaminated with parasitic worms. Yes, this is a fresh water body contaminated with a parasitic worms. What are the symptoms? The symptoms include rash, fever, chills, muscle ache, and even severe cases. Sometimes it damages the liver, intestine, lungs, and also bladder. Yes, these ones we can find these parasites something like Sub-Saharan Africa, Middle East, Southeast Asia, and even Caribbeans. This fresh water becomes contaminated from infected animals or human urine or feces. Sometimes if you have seen in some area, you will see some people will open their sewage down to stream, and people will be swimming in the stream. People will be taking the stream to cook. People will be washing their clothes from there. These are fresh water, but they are contaminated with feces of human and animal, which are not good, and they are exposed to this fresh body water. And when you go down the lane, people somewhere are taking them, and this causes a whole lot of problem. Parasites grows in them, which can affect human and can penetrate through skin and run through the bloodstream, and by that way migrate to the liver, to the intestine, and other organs of the body, and cause a severe issue for human beings. So we should be very, very careful about that. Schistosomiasis is very deadly. Another one, which is the last one, tetanus. Tetanus is the last one we're gonna teach today. This one is a very serious bacterial infection that can cause painful muscle to someone and can also lead to death. Although not waterborne, but tetanus bacteria can enter the body through a cut or wound that is exposed and is contaminated, or that gets in contact with any contaminated water or soil. This can lead to a very severe problem. Like I said, it can lead to a muscle severe pain, spasms, and stiffness. If you have seen someone that have been attacked by tetanus, you understand. Common nail that you have as a cut through your barefoot is an issue. That is how tetanus, how strong it is. So you will know if you have issue like that or have seen someone like that to see what tetanus can do. It's very deadly. It is not directly contaminated in a leg that is not wounded, but what if you have a wound in your leg, especially, and you are walking in barefoot in water? You are prone to having tetanus. Yes. Since we have seen all these and know that all these are deadly things that we can be exposed to, what are we gonna do now to keep ourselves safe? There are steps of precautions we have to keep so that we can be healthy and safe, even if we have exposed ourselves to some of these things. One of it is, first of all, we have to keep ourselves clean thoroughly. Yes, thoroughly clean. Immediately you have get yourself contaminated or get yourself in contact with this contaminated water through your food, what you should do is to wash your food with soap and clean water without wasting any time. Ensure all contaminated water is thoroughly rinsed off. That is first thing you have to do. Second thing you have to do is disinfect the wound that have gotten in contact with the contaminated raining water or any waterlogged that you have immersed your leg in. If you have any cuts or any bruises, disinfect them with antiseptic solution and cover them with a sterile dressing materials. You should do that immediately without wasting any time. And another thing very important you have to do is seek medical attention. Consult a healthcare provider promptly, immediately, without wasting any time. Inform them of your exposure to this contaminated water to get appropriate advice and treatment that is needed immediately. Don't waste time about that. That is what you must do once you have taken the first aid of cleaning yourself. Get them immediately. Tell them what happened. Another thing that is very important is vaccination. Vaccinate yourself promptly each time. Ensure that your tetanus vaccination are up to date, especially this time of rainy season, or any time of rainy season, or any time to get yourself up to date to make sure that you are free. Yes, considering getting the vaccination of all this is very important. Also, vaccination of tetanus is there. Vaccination of hepatitis A is there. If you are at risk, it is very important to do that. And fifthly, another thing you have to do is monitor symptoms that leads to all these different diseases that we have talked about. Watch for any symptoms such as fever, diarrhea, muscle pain, rash, or jaundice, and seek medical attention. If any symptoms of these things develop, don't do a self-medication or self-cure. Go for a physician and ask for help. And that thing is prophylactic treatments. In some cases, healthcare provide some of the recommendation of such. You have to have it in mind to have a prophylactic treatment. It's very important. This is recommended or recommendable by healthcare, and this prevents you from not getting these infectious diseases. It will prevent you because the antibiotics and other treatments that you'll be getting will reduce the risk. You are taking it before the time, but you should not take it on your own. It should be something approved by healthcare. Remember, it is something that must be approved by the healthcare. Yes, another one you will do for yourself to make sure that you are good is to also each time make sure you drink clean water, safe water, and maintain a healthy diet to support your immune system and to make sure that you are free from all the risk that gets to do with all these contaminated diseases. We have now know that it is very important for us to keep ourselves free from contaminating all these diseases by what? Not allowing ourselves to get in contact with them by dipping our foot in all these waters. Yes, remember that through your food you can be contaminated to all these kind of diseases because your food have connection with all the organs in your body. Yes, especially during this rainy season, avoid having contaminated. Wash off your leg immediately anytime you got contaminated with antiseptic soaps and fresh water. It is also wise for us to get a safety boot to keep ourselves free from contacting anything like that. And when you get contaminated, visit your physicians if you have any symptoms that are associated with all these diseases we have talked about. If you think that this discussion we have had today is very, very important and good to you, please make a thumbs up, like, repost so that others could also be able to get what? All this vital information and keep themselves healthy and their loved ones. Yes, remember to also comment in the comment section. Tell us other ways in which we can keep ourselves clean, safe, and free from contacting all these diseases. Remember, I still remember my humble self, Okure Moses Ikechukwu. Take care of yourself, stay healthy,